Can you see my screen?
We very much can.
All right. So, first of all, I'm going to say it's going to be a hard act to follow after Neil. He's just an incredible guy. If he's not perfect, I don't know who is perfect, you know? And Neil, we always look up to you. And thank you very much for everything you do in dentistry. Really appreciate it.
Thank you so much.
Yeah. Boss,
And
what an
before you
event.
start, Dr. Soota, just hold on, because I gotta give the audience a brief overview of what they're up for. So just to follow up on Dr. Gajjar's presentation. Now, Dr. Vic Soota has graduated. He graduated in India in 1997, and he moved to Canada in 1999, just a couple of years later. And he did a qualifying program at the Dal University in Halifax. And he completed that in 2002, which is interestingly the year I graduated my dentistry, my basic dental degree. Since then, he has bought 17 practices and opened one of them from scratch. He has been the past president for HPDA. Again, tomorrow we're going to have an introduction of HPDA from the current president, Dr. Navreet Sidhu. And he's been a past counselor for ODA as well. He's been a part of many charitable endeavors in his free time, and he's happily married, has 2 boys and a dog. He's a sports enthusiast of the Toronto Raptors and Maple Leafs, and he is also a news connoisseur. Now, although he's a dentist by profession, he likes to call himself a serial entrepreneur. And I would definitely endorse that phrase. He is definitely a serial entrepreneur, because he initially experimented with that in dentistry and very successfully created that group of 17 practices that recently changed hands. And now he is exploring outside of dentistry as well. And I have the pleasure to formally hand off to Dr. Vic Soota.
Thanks, Abbas. Really appreciate it. And it's a great event, and thank you for organizing it. And what a great cast of speakers. And I think one outshines everybody else, What a great presentation by Mike Kuttner. For those who are listening, Mike's a good friend. Mike's an amazing lawyer. I've used and dealt with him in the past many, many times. And it's going to be, he's a great resource. Please use him. And Neil said, there's nobody as perfect as Neil. I don't know who else will be there. And I've got an amazing act to follow after me, and Jackie Joking, who's a special friend as well. So I better behave, be on time, and go from there, basically, So as you can see from my title, I put this out. I like coffee and my wife likes tea. I did this for a reason. I just want to make sure everybody in this audience understands that there is no right answer. The right answer is what's right for you. Okay? Even though this statement, my wife is always right. She likes tea, or whatever she likes is always right. It doesn't matter what I like. But in life, everything is right. Beauty lies in the eye of the beholder. Do what makes you happy. Don't worry about what makes other people happy, or your neighbors doing that, or your colleagues doing that. That's okay. It doesn't matter. It doesn't matter. So let's jump right into it. I'm going to talk about my story, because my understanding is a lot of people are foreign trained dentists who are here, and I want to know if I can achieve any of this. Any one of you can. I'm one of you. As Abbas said, I came to Canada in 1999, me and my wife, 2 bags, 1 books, 1 clothes. Nobody gave us a handout. No, we didn't ask our parents, our friends, family said, no, we're on our own. I went back to school and do a qualifying program. Again, there's lots of avenues, but my personal opinion, you should go back to school. You should go back to school and experience the Canadian way. But again, NDB is a great option. Absolutely. So that's another option. Once I graduated, I came back and I started associating in floor practices. We'll talk about my associateship road, what I did. We'll talk about how I bought my first practice in 2003, to my second one, to how I multiplied, and then going from there, basically, what I did to become a multiple practice owner. So we'll go over that if you're interested. But I will not tell you what's right for you. There is lots of good ways of doing things. It's important for you to make just like your patients. You've got a missing tooth, you can put an implant there, you can put a bridge there, you can put a partial denture there. You make that judgment. What's best for you? Some people say, oh, implant. Well, maybe sometimes it's not. Maybe that patient does not want a sinus lift or a lateral nerve procedure. So maybe bridge is the option in there. Well, I don't know. So let's dive right in. Okay, so let's talk about it. You got your license. You got your license. What next? What are you looking to do next? You have multiple choices. You can go and do a master's degree, become a specialist. Great option. You can jump right in and become an associate. That's what I did. And we'll talk about that in a minute. You can go and start teaching at school. I've got great friends who are doing teaching, research. Absolutely, it's an option. You can go and you can buy a practice from day one. I know friends who've done that. You can go open a practice tomorrow morning. That's another option. Absolutely valid options. The question is what works for you. Absolutely. So let's talk. Let's talk. What did I do? I'm going to talk about my journey. And feel free to ask me questions anytime, guys. This is very informal and very easy. You can ask me today. You can ask me in the chat. You can just unmute and jump in and ask me a question. You can shoot me an email, reach out to me on the phone, whatever. Doesn't matter to me. I work 24/7, 365. And I'll tell you why I do it, but in a minute as well. So when I graduated, I decided I want to experience the world. I wanted to go, and I found myself 4 different associations in different parts of GTA. And I thought it was right. There was pros to it. I got exposed to 4 different styles. I was working in a large DSO corporate and seeing how they did work. I worked in a small family practice, and I worked in a medium practice, and I worked in a large practice that was owned by multiple owners. It was what I liked, but it was stressful because you had to go and adapt to each different practices. The patients were different, the practicing styles were different, everything was different. Actually, I'll tell you a very funny one, how I adapted. I'm a left-handed dentist, and I very fast figured out, hey, a lot of these practices are not equipped for left-handed people. Guess what? I started sitting on the right side of the chair, still worked with my left hand. I adapted. I didn't ask people around me to adjust. That's what I did. But I have friends who say, I want to go and I want to be predictable. I want to go and work in one practice. I want to stay there. I want to build my patient base. I want to do what I need to do, basically. So that's what they do. And that's perfectly viable option. 100%. You know, find what's right for you. Is it the predictability, or is it you want a diversity? You want to learn, you want to absorb. That's your call. All right. So now I associated for about a year or so. I came back in 2002, 2003. After associating in 4 practices, I was ready. I was ready to be an owner of a practice. But that was me. If any of you are ever considering buying your practices, my humble opinion, go do associateship for a period of time. Absolutely. You need to associate to learn the Canadian way. There's a lot to learn. There's a lot to learn from good principles. Good principles who have been in there for 10, 15, 20, 25 years. 90% of the dentists around are wonderful. You know, I know we've got wonderful lawyers like Michael Kuttner. Neil has his own philosophy on signing associate agreements. My philosophy is very straightforward. The agreements are there in the worst case scenario. So diagnosis is more important than treatment, I call it. Find the right associateship or find the right practice to buy, and hopefully you will never have to call Michael Kuttner and say, I've got a problem, Houston. So it's there, but do the right things, basically. Okay, rely on them as a 1% chance, in my opinion. All right, so in my case, I thought I was ready to be an owner. Maybe when you're ready to be an owner, there's various ways of doing things. Let's talk about that. My first practice, after being in the system for about a year, I was still not ready. So what I did was I found myself a practice with a veteran dentist. She was there practicing for almost 25 years and said, can you make me a partner and teach me what you do? There's no shame in that. I loved it. For 2 years, we were 50-50 partners. We did what we did the best. She taught me the ropes. She taught me things, and some of them were hilarious. I still utilize them in my life today. Most of them, actually, they were basic principles of what I do today. And then in 2005, I bought her out. But we had prearranged that there was going to be a transition in 2 years' time. And then she became an associate for many years after. Absolutely. So, and then she basically moved to United States and remarried. But that's how we worked out. So for many years, I worked in that practice. I learned, I perfected my dentistry skills. I learned a lot about systems, business things. That's what I did. You know. Now, here I am. So I should this is all out of order slide. Yeah. So I should talk about this, buying and opening. So I decided to buy, but I have a lot of colleagues who want to open practice. I will tell you, as a boss said, I had 18 practices. I bought 17. My last one was an opening. Will I do it again? I don't know about that. But you ask Neil, he's done very well for himself. So again, it's a different perspective. So can I contribute a lot about opening new practices? I probably am the wrong guy to ask about that stuff, but there's ways of doing things. So I'm going to defer to somebody else who can talk about it. I'm a buy guy. Now, I'm also a guy who buys and holds. A lot of my friends bought and sold. I never did till my last transition earlier in the year. All right. Now, I'd owned my first practice for about 2 years, so I was starting to itch again. And that's a choice again that you have to make. A lot of my friends, they just want to own one practice, and that's okay. All right. I wanted to see and expand and grow. So in I go into my accountant's office. I got 2 good boys. They're looking at me and my wife and saying, why do you want to open this? We're doing well. We're financially stable. Guys, let me tell you, I have associates who bill $1 million a year. They're very happy. And I have practice owners who bill $500,000 in practice billings, and they were happy. It's simple. But for me, it was not about money. I love the chase. I absolutely love the chase. I love the challenge. I needed to be challenged. So I went and I said, let's go buy a second practice. And there I was in 2007 buying my second practice. But let me tell you, 1 + 1 is not always equal to 2. 1 + 1 most times in this case is equal to 3. I'm in different days, in different offices with different staffs, different mindsets. What am I doing? I'm in office A, I got a call from office B and said, hey, we got a problem on this. Well, I got a patient, I got to deal with staff problems. They're not fun sometimes. They're absolutely not fun. So, but hey, I like the challenge, and some of you may not. Dentistry itself is challenging. An average dentist probably, I don't know, there's stats out there, gets interrupted just as an owner, I don't know, 50, 60 times an hour sometimes. I need a recall exam. I got somebody on the phone. Is it the specialist who's looking to see what do you want to do with this patient? You got staff asking you questions. What do I do? Do I charge this patient? I've got an emergency. Where do I fit it in? There's tons of things happening. And you got to factor all those things. The choice is, hey, do you really want to buy when you're not even on the site? What do you want to do about it? Well, I did it. I'll tell you that. And I thought we did okay. Now, 2007, we bought this. 4 years later, I said to my wife, I want to be an entrepreneur. So she looked at me again and she says, why? I don't know why she stuck around to me. I put her through a lot of stuff, basically. I wish she was listening and said, thank you very much for putting up with me. So I was ready. But at that time, I've seen a lot of dentists make this mistake. They want to keep doing the dentistry. They want to keep doing what they're doing and keep their income levels from dentistry hands-on the same way. It doesn't work. There's very little times when you can be good at multiple things and manage a lot. I'll tell you, I'm not a Superman. So I decided, so my wife said, let's sit down, let's watch. We've got 2 boys. What are we gonna do? We got a family life. And I said, okay, I'm gonna make a choice. I think I like being an entrepreneur more than I like being a dentist. So I cut back on the dentistry. I became a full-time entrepreneur and a part-time dentist. And that's what I am today too. I'll still go and do hands-on dentistry. Love doing that on a part-time basis. But I'm a full-time entrepreneur. I decided to take and look at the dentistry from a different perspective. At that time, now you see all these large DSOs. You've got the Dental Corps, 123 Dentist, Ultima Dental, many other ones that are missing their names. But at that time, there was only one, Ultima Dental. And I had worked at Ultima Dental as an associate, if you remember. And I decided I'm going to create my own DSO in some ways. And that's what I did. But how do we do it? We'll get down to that in a minute, basically. Let's go through models. Now, there is another model which has emerged in short order now. Fractional ownership. I think it's a great model. I love it. It's best of both worlds for people who are on the fence of being owners completely. Look, being an owner comes with lots of challenges. You've got human resource issues, you've got compliance issues. Neil put it all eloquently. So I don't want to repeat it again. But there's a lot of stuff. There's public health breathing on you. There's college breathing on you. There's labor lawyers breathing on you. Oh, you didn't do this. There's human rights issues. The list can go on. So here comes a really good option. Full disclosure, I'm partners with 123 Dentists. Very happy with those guys. They offer fractional ownership. You become an associate, you're working well with them. Absolutely, you can become a part of an owner. You can negotiate that, hey, I'm going to be X% owner in this practice. It allows you best of both worlds. You still go, you do your dentistry. They help you manage the marketing hat, the human resources hat, the compliance. You don't have to go look for 15 people to go and write your infection control protocols and other protocols that you have to go through. They help you with all that. It's great. It's absolutely fantastic. And I would consider that as part of a model. If you were on fence and you didn't know where you were going, maybe not a bad option. Absolutely. So there's, as I said, full disclosure, I'm part of 123 family, but as you know, there's other options. And feel free to reach out and see and talk to friends and colleagues. I think they all offer really good solutions. Absolutely. Absolutely. So let's go back. I want to go back because Abbas said, hey, let's talk about what you did and how you did it. I want to talk about how I did it and what I did it in a minute. What I did in the entrepreneurship, basically, one of the big things is risk. You have to understand what is the risk that you're getting into. If you want to be an entrepreneur, whether it's buying one practice, fractional ownership, 2 practices, or 15 or 20 or 30 or 200, risk taking is essential. If you can't take a risk, be an associate. Having said all this, I will tell you that. Do you know who's the most risk averse people out there in the market? Is banks. We feel blessed that I was like shocked when I heard this, that pretty much all majority Canadian banks will give you 100% financing to buy a practice. What does that tell you? It tells you that they don't see that this being that much risky. They don't see that. They don't see that being that it's a big risk. What other businesses bank funding 100%? And that too at the best of terms. So I'm very thankful for being in Canada. Look, there's always going to be challenges and times are going to be difficult. I've heard this over and over and over and over again. And I will tell you, this is my mantra, where I've had colleagues and friends, all things were good in those good old days. Oh, things are worse. Yes, it can always be better, but my mantra is my glass is not half full or half empty. My mantra is very clear. My mantra is my glass is as full as I want to be and with whatever I want to be. Remember, it's daytime, it's coffee. Sundown, it's scotch. It's what I want to be. My wife likes tea, and that's fine. She likes red wine, it's okay. It's your call. But it's a good business. And I'm very thankful for being in this country. And you adapt, you learn, and you live with it. If you don't adapt and you don't learn and you don't go to the next level, you will be left behind. That's what it is. It's flowing water, basically. So how did I do this? How did I build this? I'll tell you, it's nothing to do with me. It's all about my team. They made me look so good. They made me look so good. They were part of my family. I had a structure in place. I had things in place where it was there and said, okay, let's put this. Everybody had a role to play, and everybody had a job description to play. I didn't get a phone call for a lot of things. I created a culture where my 18 managers called each other and said, hey, I have a problem. Do you have a similar problem? Have you experienced this? Can I basically do this? Or how did you do this? By the time I heard about it, it was too late. It was already solved. They made me look good. We had managers, we had team leaders, we had a CFO in there, we had admin assistants doing things. And I will tell you, I was blessed with the best ever team in this thing. And I can't thank them enough. I tell them I love them every day. I love them more than my wife. That was fun. It was pretty cool, basically. And they absolutely made me look good. And I'll tell you, the big thing there was learning to work with each other. I had to listen to my team because I knew they were watching my back. They were telling me what was the right things to do. It was not always I had the brightest of ideas in the room. There were a lot of good ideas in the room when we met. I had to learn to live with them. But you know what we did was we put structures in place. We put systems in place. Let's talk about it. I put metrics in place. I said, this is what my dental supply cost should be. This is what my staffing cost should be. I never micromanaged. I never said to my associate, you can't use the 3M bond, or you can use the Dentsply bond or a Kerr composite. It didn't bother me. We made our deals with all the suppliers and all the dealers and I told my manager and said, this is the metrics. I absolutely never micromanaged and said, this is what we're going to do. I gave them the freedom to practice the dentistry that they wanted to practice. Because I never got that choice and that happens in 80% of the places. That the principal says, you got to do this. You only going to use Dentsply bond because that's what I get 2 + 1 from. Well, it is what it is. But that's how it is. But that's part of the teamwork. Treating your associates the right way as well. It was very, very important. I had over 42 associates. And I will tell you the majority of my associates were long-term associates. I probably had about 5 or 7 over the years that kind of left and opened a practice or bought a practice and did whatever. And we're still friends, no problems. But 80% of my associates stayed with me because I treated them and they knew that they could use them as their own practice. That was part of my success, I'll tell you right now. You know? So let's talk about what's 80-20. If you can get your head around this, that will take you to the next level. Let me explain this in my next slide. Everybody in this audience is a smart person. You're a dentist. You're all overachievers, type A personalities. I get it. I am one of those. Type A's, type AAA. I get it. But let me tell you, if you want to achieve success, look at this chart again. And you need to figure out where do you want to sit in this chart. Look, everybody around cannot be as focused or anything and efficiencies wise. What did I tell you? I never bothered and said, hey, we bought 3M bond or Dentsply bond or this composite or this cement. I focused on 80% and not the 20%, because that gave me a big picture story. It was very easy for me to get to 80%. I had to work really hard to get to 80 to 90%. From 90 to 97, holy mackerel. That was when I was in my first practice. I thought we were running at about 95%. 100%, I consider it mission impossible. Unless you're Superman, I don't see that happening. If you want to do every job by yourself, I don't even see them that that's happening. You're gonna miss something. So you need to figure out that you're okay to leave some things on the table. I had friends and colleagues that, you know, that so-and-so at the front desk, she's on her cell phone on Facebook or you know what, or this is happening, there's stuff that's being wasted and that's expired. I understand that. I would rather take a small piece of a big pie than take the whole grape. I would rather take a big slice out of a watermelon than a full grape. That's my philosophy. That's 80-20 rule for me. I aim for 80, I look for 90, and I'm happy when I get to 90. I'm okay to leave certain things on the table. All right. Abbas, how are we doing for time? I know we were a few minutes behind.
Yeah, we have, ideally, we have about 5 minutes.
All right, okay, let's go through this. I don't want to keep Jackie waiting. She gets mad at me. No? Yeah. All right. How much sugar do I want in my coffee? My grandmother always said, Sonny boy, you need to put sugar in your coffee if you want it sweet. Guess what? Sugar costs money. And in this case, the sugar is risk again. How much risk you're willing to take? How much, sometimes again, remember that 80-20 rule, how much you're willing to leave on the table. You got to look at your metrics and say, what makes sense for me? What makes sense for me? Is it, am I okay? That's what that means. Okay. Let's talk about success. Again, it's going back to my old concept. It's a very perceived word. I have friends who are happy working 3 days a week, producing $200,000. They're very successful if you ask them. And I have friends like my friend Dr. Shivji from 123 Dentist, who wants to probably own 5,000 practices, utilizing the eye of the beholder. Success is what you perceive to be. Don't look to your left, don't look to your right, just look in the mirror and say, hey, I'm happy, I'm successful. Let me tell you, I will tell you very clearly, I don't do what I do for money. My needs are very, very limited. I still shop at Walmart and Costco, and I don't go to Whole Trend Fruit. I don't do any of those things. I do what is right. I love the chase. For me, solving a challenge and getting to the next level and next floor means success. If I can crack the code, if I can make things efficient, that's success for me. So look, getting to Canada and getting your dental license is the biggest success, in my opinion, you will ever achieve. No matter what you say, look around the world. This is a beautiful country. Absolutely. All right. Let's talk about some questions. I don't know if you have questions. Anybody have?
Guys, anyone has any questions? I think there has been so far some amazing lectures, and had a few good questions come up. But this is, I think what's happening is that this is so much amazing content for people to kind of absorb. They're mostly sitting there being a sponge and imbibing everything that's coming from Dr. Soota, Dr. Gajar, Michael, and amazing information. So it might be a bit overwhelming. I am aware of that, but these are amazing pearls that will help people in the long run. And we have a comment here. It's a thank you comment from Hanani. Amazing. So guys, the idea of this this talk was basically to give you a sneak peek into what your future life could be and what are the resources. These are wonderful people that you could reach out to for advice, for help, and amazing resources, amazing experience sharing. I think the best thing that one can do is to learn from other people's experiences and other people's thoughts, because you're going to be there very soon, but might as well, instead of learning the hard way, take it from those who've been there and done that. And this has really, I think, helped us a lot. Thank you, Dr. Soota.
I'm going to end on thing. Abbas, thank you very much. I wish I had met somebody like you when I came to this country. You're doing fantastic, helping these people and putting them. Nobody ever, invited me to do things that you're doing right now. So please do it. Keep doing what you're doing. Help out. I'm here to help anybody. As I said, I'm one of you guys. I'm here to help any one of the people that need help or want help. Absolutely there. My information's right there, or you can always reach out to Abbas and call me, email me, whatever it takes.
Sina, Sina has a question, very pertinent. Sina, you want to unmute yourself and go ahead?
Yeah, I just want to comment, Vic, for everybody's benefit, in Canada, only 5% of the total number of practice owners have 20 or more locations. So Vic, in a population of 40 million in Canada, I would say you're one of the top entrepreneurs in terms of what you've done. And it's extremely beneficial for everybody here that's had a chance to kind of listen to your story, hear about how you got to where you did, because what you've accomplished in your career is quite incredible.
Thank you. That's very, very kind of you. Thank you. And as I said, it's not me, it's the people around me, the team, whether it was my in-house team of my managers, my CFOs, my associates, my assistants, hygienists, front desk, they make me look good, And one other big thing I'll tell you, part of my success, choose your advisors right. My lawyers, my accountants, and the dental brokers, Michael Kuttner, my lawyers, Lita Herskowitz, my lawyers were Marty Hauser and Gavin Beerer, dental brokers like Jackie Joachim, I think I can call her my good special friend. She beat me up a few times, that's okay. But, she was very kind to me for most parts and told me when I was doing right and wrong. So listen to people around you. Yeah. So those are the people. More importantly, listen to your wife. Those are the people that they're looking for you.
Question about investment. Sina had put a question whether you focused your investments completely on dentistry, or have you looked at something outside? I just have recently had a sneak peek at the outside part, but I'll let you answer that.
Yes, as I said, as Abbas said, Andrew, I'm truly a serial entrepreneur. I probably wear right now about 6 different businesses that I'm involved in right now. My latest one I'm doing is I'm gone into real estate development, basically. So that's my newest passion. But I've been involved in many other businesses.
Ask you a question, Dr. Soota. That's what you've decided to pursue now. Now that you've kind of shed the load of your 17 practices. Up until that point, was your focus mostly on dentistry, or during that time as well you were juggling around with a few things?
I was juggling with a few things, but not to this extent. My focus pre-partnership with 123 Dentist was dentistry for sure, yes. Again, I always have lived by 80-20 rule. My 80% focus was dentistry, yes. Now it's reversed.
There's a question whether you would recommend a dentist to go through an MBA to actually evolve into an entrepreneur, or does it happen? Is it possible to do it? Does it happen by itself? Can it happen by itself, or do you need to formally go through a certain process?
Listen, again, I think MBA is going to help. I actually considered doing an MBA back in those days.
But now you can teach MBA people, Dr.
No. I learned the hard way, and as I said, I had to listen to people around me. But I think MBA would be helpful. And if you ask me, I would probably consider going and doing MBA again if my wife allows me to do it.